Hi everyone, this is Dr. Pasunuti Sumanth, and this video is regarding the harmful effects of thumb sucking in children and its management. Thumb sucking is commonly seen habit in children, and the reason behind this sucking their thumbs is because babies have natural rooting and sucking reflexes which cause them to put their thumbs or fingers into their mouths, sometimes even before birth. And the other reason is thumb sucking makes babies feel secure. So, some children might eventually develop an habit of thumb sucking even when they are in need of soothing or going to sleep. So, how long does thumb sucking usually last? The answer is most children stop sucking by 6 to 7 months or between the age group of 2 to 4 years. But sometimes the child who stopped sucking his thumb might eventually go back to the behavior during the times of stress. So, when should parents intervene? Usually, this is not a concern until the child's permanent teeth starts coming in, and at this point, it might affect the roof of the mouth or how the teeth line up. The risk of the dental problems is related to how often, how long, and how intensely your child sucks on his thumb. American Academy of Pediatrics says treatment is usually limited to children who continue thumb sucking even after 5 years. So, why is thumb sucking harmful? The most serious permanent side effect of thumb sucking is dental malocclusion. Is nothing but the disturbance in the line of arrangement of teeth in the upper and lower jaw. Among these, there are two common types of malocclusion caused by thumb sucking, that is open bite and overbite. Open bite occurs when the top and bottom front teeth become directed outward. This means that the front teeth do not touch even when your child's mouth closed completely. The second one is overbite. This means that the top teeth cover the bottom teeth when your child's mouth is closed rather than the top and bottom teeth touching normally. Third one is skin problems. When exposed to the continuous moisture of the mouth, the skin can become vulnerable to other injuries. In some cases, the skin may crack or bleed, making your child's hands vulnerable to infection. The fourth one is speech impediment. Because thumb sucking affects the development of the teeth, jaw, and palate, the habit can also change how your child eats and speaks. This may cause lisping and other speech impediments, including an inability to pronounce hard consonant sounds like D and T. Fifth one is social issues. The older your child gets, the more other people may judge him or comment him regarding the continuation of the habit. So, what can I do to encourage my child to stop thumb sucking? Sometimes, paying no attention to the thumb sucking is enough to stop the behavior, especially if your child is using this thumb sucking to get attention. Best way to get rid of this habit is positive reinforcement. Praise your child or provide small rewards such as extra bedtime story or a trip to the park when he is not thumb sucking. Set attainable goals such as no thumb sucking an hour before bed, or place stickers on a calendar to record the days when your child successfully avoids thumb sucking. Identify the triggers. If it's happening in response to stress, identify the real issue and provide comfort in other ways such as with a hug or reassuring words. Offer gentle reminders. If the child is not doing this to get attention, so gently remind him to stop and don't scold or criticize or ridicule your child. So, when to visit the doctor? When your child is above 5 years and still has thumb sucking habit, definitely you should visit the doctor, and child should be examined thoroughly for the complications. For some children, a chat with the doctor about why it's important to stop thumb sucking is more effective than a talk with mom or dad. If the problem is significant, doctors might recommend using some unpleasant techniques such as covering your child's thumbnail with a bitter substance, bandaging the thumb, or covering the hand with a socks at night. So, my dear parents, this is all about everything you need to know regarding thumb sucking in children. And if your child is above 5 years and still have this habit, please do consult the doctor. And thanks for watching.